Hi everyone, and welcome back to our medical podcast where we break down the hottest health topics in plain language. Today we've got a super buzzy story, the huge fine against makers of Ozempic because of reported complications. What happened? Why is this drug making so many headlines? And what should anyone considering it for weight loss really know? With me in the studio is our guest expert in functional and longevity medicine, Dr. Alla.
Hi, and thanks for having me. I'm glad we're talking about this because there are so many myths and half-truths flying about Ozempic. It's definitely a hot topic and an important one.
Let's start with the news itself. The headlines say, Ozempic under fire. Company pays millions of fines for complications. What's the story?
So here's the situation. The manufacturer is facing lawsuits because some patients say they experience serious side effects, and what they weren't fully warned about them. The company ended up agreeing with a large settlements. The cases include severe gastrointestinal problems, pancreatitis, vision issues, and even mental health concern. And the big claim is that the risks weren't communicated clearly enough. So the key point is these weren't isolated cases. It became a widespread issue.
Okay, but first things, what is exactly Ozempic?
So Ozempic is the brand name for Semaglutide. It is a peptide drug, basically a chain of amino acids, and it belongs to the GLP-1 receptors agonist class. So GLP-1 is a hormone our gut naturally makes to regulate blood sugar and appetite. And when you inject semaglutide, it mimics that hormone. That means slows down stomach emptying, reduces hunger, and helps with the blood sugar control. It was originally designed for type 2 diabetes, but then doctors noticed that people were also losing a lot of weight. And that's when the boom started.
And suddenly a diabetes drug turns into the hottest weight loss shot. Total social phenomenon. First studies showing people losing 10-15% of their body weight. Then Hollywood, influencers, TikTok. Before long, people were calling it a magic shot for weight loss.
Exactly. The problem is that millions of people started using it without proper medical supervision. And this is a drug with a major systemic effect. It's not something to just grab off the shelf.
Okay, let's be real. What are the risks? What are the side effects that lead to this scandal?
Semaglutide definitely has side effects. Doctors have always mentioned them. And the most common are nausea, vomiting, bloating, diarrhea and constipation, appetite suppression that sometimes goes too far, leading to dehydration or nutrient deficient, flares up of stomach and pancreatic problems. But more serious risks include pancreatitis, gallbladder issue, vision problems like loss of vision, sharpness, or even optic nerve damage. And in some cases, even changes in mental health, such as a depression, suicidal thoughts, or even panic attack. So if it's prescribed to the wrong person or without considering contraindication, it can actually be life-threatening.
I've also heard people say Ozempic can damage the optic nerve. But from what I understand, it's not the drug itself, but the rapid drop of blood sugar in diabetics, especially if the sugar is uncontrolled for a long time. Is it right?
Yes, exactly. When blood sugar is chronically high, the blood vessels in the retina adapt to that. So if the sugar suddenly drops, for example, when starting semaglutide or insulin, it puts stress on those tiny vessels. And that can temporarily worsen diabetic retinopathy or cause vision changes. So no, the drug isn't directly toxic to the optic nerve. It's the sharp sugar swings in poorly controlled diabetes that are the real risk.
And how do you reduce that risk?
We can do it by lowering blood sugar gradually, having an eye exam before starting treatment, monitoring vision regularly while on it, and of course managing other risk factors like high blood pressure and high cholesterol. The bottom line, the drug itself is safe for the eyes, but you need good diabetes management and medical oversight.
So it's definitely not take and forget kind of shot. I've seen patients on Ozempic myself. Some say it's amazing, I lost 25 pounds and feel great. Others, yes, the weight came off, but I am constantly nauseous, I can't eat properly, and my hair is falling out. And some gain weight right after stopping using Ozempic.
Exactly, and that's the key. The drug only works while you're on it. It doesn't fix the root cause. It suppresses appetite, slow digestion, but if someone doesn't use that time to change their lifestyle, eating habits, exercise, sleep, stress management, then once they stop, their weight comes back, but the side effects may longer.
That's worrying. So is it always a gamble?
Not necessary. 3 important points. It's not for everyone. A doctor has to evaluate the risk factors, and patient may have conditions they don't even know about. It's not forever. It was never designed as a lifelong weight loss hack. It's a temporary therapy while lifestyle changes happen in parallel, and monitoring is essential. So blood tests like liver, pancreatic checks, vitamin minerals level, and many complications could be catch early if patient were monitored properly.
And are there people who absolutely shouldn't take it? Besides patients with the personal family history of medullary thyroid cancer, or men too?
Yes, contraindications include severe gastrointestinal disease, especially delayed stomach emptying, serious liver or kidney disorders, pregnancy or breastfeeding, children under 18, because no one basically examine them, and history of pancreatitis, severe uncontrolled heart failure, decompensation of the liver or kidney disorders, allergic reaction to GLP-1 agonists or their components, and these are written very clear in the international guidelines and should never be ignored.
And then there are the red flags, warning signs, where patients need to stop immediately and see a doctor. Things like severe ongoing stomach pain, possible pancreatitis, uncomfortable vomiting, no bowel movement for several days, jaundice, dark urine, extreme fatigue, possible liver problems, shortness of breath, chest pain, leg swelling, possible heart complications, allergic reactions, rash, facial swelling, trouble breathing, very rapid weight loss or dehydration, sudden vision loss or major changes in eyesight. If any of these show up, the drug should be stopped immediately and you need to go to a doctor.
Exactly. Those are red flags you can't afford to ignore.
Then why did the company get fined? Side effects are usually listed in the leaflet, right?
Yes, but the legal issue is about whether the company communicated the risk clearly enough, both to doctors and to the patients.
Right, and the lawsuits say the information wasn't transparent enough. Plus, the massive hype around the drug made it worse. People started taking it without proper medical need. So, is there any way to reduce or avoid side effects?
Yes. First, normalize your diet. Make sure you are getting enough protein and fibers. Stay well hydrated. Support your gut health. Pay attention to your pancreas and gallbladder function that can reduce the risk of serious complication. And ideally, restore a healthy gut microbiome before starting treatment.
And the most important thing, remember, this is a prescription drug. Never take it on your own, only under doctor's supervision. Get labs done before starting and then keep monitoring regularly. Okay, let's wrap it up. What's the bottom line for our listeners?
Here it is. Ozempic is not a magical bullet. It is a serious medication. It can be safe and effective, but only when prescribed properly and monitored. If misused, the risks are very real, and no injection will ever replace lifestyle changes.
Thank you, Dr. Alla, for breaking it down so clearly. And friends, what do you think? Should drugs like this be more widely available or more tightly controlled? Leave your thoughts in the comments. And don't forget to subscribe to our podcast so we can keep bringing you medical news without the myths.
Take care, everyone, and stay mindful about your health.